This episode contains discussions about opioid addiction, drug use, and mental health, including references to substances such as fentanyl and heroin. These topics may be triggering to some viewers. Viewer discretion is advised.
Welcome back to Health Simplified, brought to you by Sentara Health Plans, where we improve health every day. I'm your host, Bradley Wanzer. No matter who you are or where you are on your health journey, this podcast is designed with you in mind. We're giving you simple answers to big questions surrounding health. No big words, no fluff, just facts. Today, we're continuing our conversation about opioid use and addiction. If you caught part one of our discussion on the opioid crisis, you know we covered a lot. How opioid addiction starts, who's most vulnerable, and the impact it has nationwide. If you haven't listened to that podcast yet, I highly recommend you going back to check it out, because today we're picking up right where we left off. In this episode, we're shifting focus to what comes during the recovery journey. Once again, I'm joined by Shambri Myers, an expert in behavioral health and substance use treatment. I know we covered a lot last time, but there's still so much more to dive into. Let's get started. Shambri, thank you again for joining us on addressing more on opioid addiction and recovery.
Absolutely, Bradley. It's a pleasure to be back. This is a topic that's so near and dear to me. I'm so passionate about bringing awareness to the opioid epidemic, and I am just elated that you had me back.
As we've discussed earlier, when going through the recovery process, there's a withdrawal period. Is it all happening at once? You know, like you're having flu-like symptoms and then being irritable and...
Well, there's also going to be an intense urge to use because when we're in discomfort, what do we want to do? We want to stop that discomfort. We want to feel good again. Even if we don't feel great again, we want to feel at least normal. And so those urges are stronger than ever because, again, their intense pain and their anxiety has risen. Their depression may have risen really quickly because, again, they went from a state of euphoria and now they're without that, on top of feeling all the physical ramifications of withdrawal. Even if someone were still like very much active in their addiction and they're, not intentionally entering withdrawal, just like if I can't get the money to get that drug, there is a level of anxiety because you know that you're going to enter withdrawal. So they're always technically in a state of heightened anxiety because it goes with that drug seeking. They're hyper fixated on how am I going to get my next dosage. If money isn't a barrier, it could be, what if my dealer, is delayed or it's out? So there's always going to be that sense of worry or anxiety anyway. So when you're in withdrawal, there's anxiety about, hey, now I'm feeling all these things. And, some people started using drugs because they may have had anxiety disorder untreated. And so that didn't go away with the drug. It was just dulled. It was numbed.
Okay. And as you're like explaining the symptoms and part of the recovery process of being prepared, this is what family members need to be aware of, seeing their loved one go through with it, this recovery. Now with this, how long can this last as they're going through the process? What can happen?
Well, everyone is different, but generally the physical withdrawals can last up to six days, up to 2 weeks. And then there's protracted withdrawal that can happen later on once they thought that they were out of the initial state of physical withdrawal. So it could definitely last up to 6 months, really. It just depends. Everyone is different, but the initial detoxing, heightened onset of physical withdrawal usually lasts about a week.
And you mentioned before, the symptoms can vary depending on what they were using, how long they were using, the amount, like, so as we're addressing a lot of symptoms here, it really does depend on what originated the use, correct?
Absolutely. And then in terms of the psychological symptoms, that's an ongoing process. Again, some people may have started using because they were depressed or they were anxious and battling anxiety. So if they already had these underlying mental health issues, it's only amplified during that detox phase or that withdrawal phase. So um, there's going to be a need for treatment of those symptoms as well.
What are the treatment options after the withdrawal? Like, what would be next?
Determination on what types of treatment or what treatment is going to look like for the individual should be person-centered. So it should be individualized.
Okay.
And medicated assisted treatment is a medication option
Okay.
that assists individuals as they are transitioning from illicit drug use. And so what happens is they would abstain from illicit drugs such as non-prescribed or purchased pain pills,
Okay.
heroin, things like that. They would discontinue use of those illicit drugs, and in, instead they would be choosing to use a medication that is prescribed and regulated and administered and overseen by a physician. And those drug options are methadone,
Okay.
which is the oldest form of medicated assisted treatment. And then there's also buprenorphine or suboxone. And then there's naltrexone. And so with methadone, the individual would usually have to go into they would have to go into a facility to dose daily.
Okay.
They would get their dose, and what happens is the medical provider would start them on a lower dose and taper them up, increasing the dose that is,
Okay.
and then they'll get them to their therapeutic dose. They will know that they're at their therapeutic dose when they're no longer having any of the withdrawal symptoms.
And that could be could that be the physical and mental?
The physical.
Physical, okay.
Yes. And when you address the physical symptoms, a lot of times that's going to mitigate the surface level mental symptoms. So if they were having anxiety around, the withdrawal, or anxiety that they would normally have from, hey, I'm not well, there's going to be an increase in anxiety. So once they have started to get close to their therapeutic dose, and of course, once they've established that therapeutic dosage, then they are, they're probably not seeing as much anxiety. That depression around the drug use itself has most likely dissipated. Now, that does not take away from the fact that, again, if that was their underlying mental health disorder, that still needs to be treated.
Okay.
If one is seeking the medicated assisted treatment route, it should be a shared decision between that person and their provider as to which medicated assisted treatment drug they select. If someone is going to go the cold turkey route, then there's also a need for a discussion because they need to be linked to psychotherapy. And then there are other options for medicated assisted treatment that aren't what people typically go to, like methadone and suboxone. There is naltrexone, and that's a good option for someone who is able to go through the withdrawal process and actually taper off completely. In order to prevent relapse, they can go to choose naltrexone, which would prevent them from relapsing in that it prevents the cravings. But for that one, that treatment option, you have to have detox completely
Okay.
off the opioid. So that's, usually recommended for someone who says, hey, I'm going to go the cold turkey route. And so, yeah, it's a good option. But again, it needs to be a discussion between that person and their provider to determine their best next steps.
Okay, so communication and having the questions and just being aware, I guess, having that conversation.
Yes, because a lot of individuals aren't aware of the treatment options,
Okay.
and then they need to be educated. What does this treatment option look like? For instance, if someone is inquiring about methadone, they need to know that yes, methadone is one of the oldest. It's the oldest form of medicated assisted treatment. It's most commonly used, but it's also heavily regulated. And what that means is, are you prepared to go to a treatment facility every single day for dosing? Are you prepared to undergo a long taper? Because when you taper off methadone, it needs to be a therapeutic and slow taper to prevent or enhance their chances of not returning to use or illicit drug use. Bradley, it's a very involved process. So again, someone can choose to go the cold turkey route. But a lot of times individuals who go that route do return to use because the withdrawal symptoms are very overwhelming.
Yeah, to the
They're,
extreme.
they're,
Based on
they're
what it's like,
extreme.
yes.
And then if you go the cold turkey route, some individuals are, less likely to engage in the therapy. So there's also a psychological component to treatment. And if they are not working on themselves, working on what initially turned them to use, if they're not, combating, any past trauma, if they're not learning what their triggers to use are, if they're not developing coping skills, if they're not developing a recovery network, then that places them at a higher risk of returning to use. And then if they decide the medicated assisted treatment route, that's considered in the substance use treatment realm as the more humane approach.
Okay.
And humane in that, again, the withdrawal symptoms are brutal. And then when you think about from a developmental and a recovery component in terms of our bodies, when they were using these synthetic opioids, that rush or that increase of synthetic opioids, what does that do to our bodies? What does that tell our brain? It tells our brain, hey, the endogenous opioids that are naturally developed in our bodies, stop making them. We don't need it because we're getting flooded with the synthetic. So it takes time post abstinence for your body to start developing those endogenous opioids again. So during that time period, that is a very cumbersome process. So entering medicated assisted treatment will provide their body an opportunity to dull those withdrawal symptoms, and while your body stabilizes.
Okay.
And then once you are at a place where you're ready to detox, or once you've worked the program, you can do a slow taper. And so again, that's why it's considered in the treatment field as the more humane approach, because you're giving your body grace.
Okay.
You're giving your body understanding and time to rebuild what was torn down during your illicit drug use, essentially.
And then that would be under the supervision of your doctor. So at least then you have that support system to help you with that process to keep track of everything.
Absolutely. And then with the medicated assisted treatment being so heavily regulated, there's also, requirements. So you can't say, well, I'm going to go to treatment and I'm just going to dose and then leave. Oh, no. Have you been to your counseling session this week? You have to attend group and individual counseling sessions. So you get that support, you get the other components of treatment that are required. However, it is not uncommon for an individual to be in medicated assisted treatment for at least 18 months. I will say, Bradley, there are individuals who have been in medicated assisted treatment for 20 years, 30 years. So it is very individualized.
And could it be less than that?
It could definitely be less than that. I've seen individuals come in and they got into their therapeutic dosage within the first 45 days. They maintained that for another 45 days, and then they started a slow taper. And a taper means to wean off that medication. So say my therapeutic dosage of methadone is, 70 milligrams a day. The medical provider will do a slow taper off of methadone where they may decrease by maybe 5 milligrams every week and a half to 2 weeks.
Oh, okay.
And they will do a slow taper because you have to give time for your body to adjust. If you do it too quickly, they may start to experience withdrawal. And if they haven't built up the skills to, withstand that withdrawal psychologically, then it could provoke a return to use or a lapse, a relapse. In that time period, they're also they should also be working on establishing a support network.
Okay.
They should be establishing, things to help them post treatment. Like what does life outside of the recovery look like? What does life look like post recovery? They should be working on those things while they're in treatment, so that when they're out of the medicated assisted treatment portion, because they're going to be in recovery for the rest of their lives, they're going to always have to work on, their steps. What are my triggers? What do I do when I'm feeling triggered? What does my social system look like? How do I account for, situations where drugs may be there? What am I doing to keep myself safe? The goal of treatment is that once they have completed the program, they're leaving with a plethora of skills in their bag. They have relapse prevention skills. They have coping skills. They have a list of individuals whom they can call when they may be feeling distress, when they may start thinking about, the good old days of when they were using. They have all these things in their toolbox so that they can weather those post-treatment storms.
Thank you for explaining part of the process for recovery, but you did mention about relapse. What are some of the early signs of, are you in a relapse? Are you going to have a relapse? I think just understanding that from the individual's perspective, but also for a family member that's providing support, what do we need to be mindful of?
That is a great question, Bradley, and it's something that the patient has to be cognizant of, as well as their support system. So I thank you for including their family and support system in that question. So for the individual, during the recovery process, especially once they've gotten into treatment, they start to develop a new routine.
Okay.
That routine could look like, okay, I go to work, I, go to the gym, because you have to start some pro-social activities and some things to replace the time that you spent using and seeking drugs. And of course, things that make you feel good and what makes you feel better than a great workout. So they've established a routine, and deviating from that routine is a sign of a possible impending relapse. Another sign is if they are reliving memories of the happier portion of addiction. If they start to remember, like, oh, I used to feel so great when I was using, or I had more confidence when I was using, I was less anxious, I was more social, and they start to remember the what they would consider the good parts, and so if they're starting to discuss that with you as a family member, I think one of the best interventions is to remind them, like, hey, it, I hear you, and I can't take that from you, but there were some really awful parts. Do you remember when you lost your job? Do you remember when you embarrassed Sarah at school because you came in there intoxicated. Do you remember, losing yourself in that? Do you remember telling me at your lowest point that you had lost your dignity, your job, your family, your friends, money? So reminding them gently, of course, of the negative ramifications of that use, because it's easy to remember, like, the good things. From their perspective, like the more confidence, again, the ability to enter a room and kind of take command of it without feeling insecure, that lack of pain, and when they were encountering stressors and just life, just being able to numb it with that drug. So it's easy for them to remember those good things, but they have to gently be reminded of why you had hit your rock bottom, why you decided that you needed a change. It was not all sunshine. A lot of times when individuals are in treatment, one thing that a therapist will encourage them as they develop in their psychotherapy component of treatment is sometimes we have to go back and reparent ourselves. And what that looks like is teaching yourself to not be so critical, validating yourself more, giving yourself grace for things, learning from your mistakes, acknowledging mistakes, but also saying, okay, I acknowledge that, but what can I glean from that? How can I, change that? So sometimes we have to reparent ourselves in order to, mitigate things from the past that may or may not have contributed to our use. And so as a family, acknowledging where we may have, every family has, its issues.
Yes.
Acknowledging those discrepancies and being mindful not to continue in them. So if you have an overly critical aunt or a mother who, expects perfection from you, just, not being so critical and being validating, even if that person has a bad day and you can see that they're kind of off that day, they may be sad, or they may, just not be at their best selves that day. Give them some encouragement, validate them. You know what? I recognize that today, it's not the best day for you, but I just want to let you know that you've been doing a really great job. And today may not be the best day, but tomorrow could be better. But I'm here. Just again, being validating, supporting, less critical.
Okay.
Um,
'Cause that goes to some of the triggers that you mentioned before. So, I mean, this would be a process for the whole family.
it would be.
Okay.
It would be. And it's a learning experience for the entire family. When that person starts on their recovery journey, you learn a lot about yourself because you have to finally face yourself. You can't run from yourself hiding behind the drug at this point. You have to face yourself. And that is difficult, even for individuals who are not encountering a substance use disorder. All of us, when we have to put that mirror, up and really look at ourselves, it's very challenging. So these are individuals who are also carrying a lot of shame and guilt around their addiction and things that they may have encountered or started doing while they were in their addiction. So on top of just our normal things that we carry that, makes it hard to face ourselves sometimes, they have that baggage. So that's very heavy. So you need support. You need, a system where you have people around you in place that will pep you up, if you will, when you're not feeling that well, and remind you, yeah, you've come a long way and you're doing great. Keep it up. I am an advocate for peer support because when you have even someone who has family or friends, even coworkers, they may not have that lived experience. So it's different. It adds a different element when you have someone who has that lived experience and who have overcome and gotten to a phase or place where you desire to be in your recovery journey. You may have a peer support specialist who has 20 years of abstinence. And of course, if you're in recovery, that's the goal. And so just having someone who can relate to the things that you're encountering, they can relate to, the good parts of your recovery journey where you're learning and you're gaining all these skills and you're working on previous trauma that you buried in addiction, and you're becoming strong and confident, and you're, becoming more self-aware, all these wonderful things. But then someone who could also say, you know what? Not all of these components of recovery is wonderful. There are some really dark days. There are some, hard times when having to recount what I've done or faced my past. And you know what? It's hard,
Yeah.
but you can get through it. To have that from someone who's actually had to get through it, who've been there, that adds again a different element of support. So I recommend peer recovery specialists. So connecting with the peer, also support groups. And I get it, support groups aren't for everyone. So the good thing is, with technology being what it is today, we can do support groups in terms of focus group. Internet groups.
Okay.
Reddit has a lot of subgroups of people in recovery that you can connect with. Online support groups. Facebook has a good one, Rockstar Recovery. There are so many online support groups you can connect with, and in person. Some people are more social, and some people require that level of accountability with meeting with people and having to be at a designated place at a designated time. That could be a part of their newly developed routine, and that's great. So support groups, they're also amazing.
Shambri, as we're talking about the recovery process, I want to take a step back and just understand, like, what are some of the barriers, and how is that impacting programs and the individual and families? Just knowing we're trying to move forward, but what are some of the barriers that could be a setback or be problematic?
So, Bradley, there are so many barriers, unfortunately, to effective treatment.
Mm-hmm.
Some of the barriers are just around the regulations
Okay.
associated with medicated assisted treatment if an individual is going to go that route. For instance, methadone, for instance, it's highly regulated, so the individual would have to come into the clinic every day for dosing.
Yep.
However, in most methadone facilities, once they've established a therapeutic dosage and they have had a number of urine drug screens that were abstinent of all illicit drugs, they are able to earn take-home doses where they start off with, okay, you don't have to come in on the weekend, you'll get 2 take-home doses. So that means they're only coming to the clinic 5 days a week as opposed to 7. They can continue to increase, and I've worked at a treatment facility where individuals have a month's worth of take-home doses.
Yeah.
And the caveat is just that they have to be available for a callback. And what that looks like is it's randomly done. The nurse will call and say, hey, today's your day. And what they'll have to do is they'll bring all of their medications that they have in their lockbox and bring it up to the clinic. The nurses will count to make sure that they haven't used more than they were scheduled to use, and they'll have a observed urine drug screen. If they pass that take-home, that callback, then they go on and they'll continue. But if they, for instance, have less doses than they should, or if they have a positive urine drug screen, then they'll go ahead and lose their take-home privileges. Fortunately, they can gain them back, but what does that look like if I have work? If I'm, working and I've gotten to a place where I have 30 take-homes and I only come into the clinic once, I'll just say twice a month because you have to account for that callback. And now all of a sudden I have to go back to dosing daily. What if I live 45 minutes away and I have to be at work at 6 o'clock in the morning? Dosing starts at 5, but there's a lot of people who have to be at work at 6, so the line is wrapped around the building.
Wow.
That is a barrier. I can't continue and engage in treatment if I can't take care of my social determinants, such as, housing, my insurance. If I don't work, I can't pay for my housing. I can't feed myself. I don't have health insurance, those things. So that is a barrier to treatment, just the regulations. Another regulation that I've witnessed that interferes with individuals' ability to work and take care of themselves is the mandatory groups. You know, the psychological component of treatment is equally as important as the medical component in terms of the dosing. However, if the clinic that you are enrolled with only has group meetings at 11 a.m. and you have to participate in at least one group meeting a week, what am I to do if I work a 6 to 3 job? If I can't leave work once a week, I'm gonna pick work over everything. I can't pay for treatment if I can't work. I have other obligations that I have to take care of. So work is gonna take precedence. And so that's another barrier. What I will say is COVID did show us that telehealth it's very helpful, and it contributed to treatment consistency. Individuals were able to maintain their individual and group therapy through telehealth. Another thing is a lot of suboxone clinics. That gives a little bit more wiggle room because it's not as regulated as methadone in terms of a doctor could prescribe suboxone, and while you still have to engage in like the groups, you're not bound by going to this clinic every day. Once you've established your therapeutic dosage, you can get your prescription for, let's just say, a week, and you may have to just come in once a week for counseling. So it gives a little bit more flexibility. We're making waves in terms of making treatment more personalized, or meeting the individuals where they are in terms of, they still have life. But unfortunately, due to the nature of opioid use disorder and the medications used to treat it, they have to be regulated. So we can't get around that.
Yeah.
But we are making waves in terms of just meeting them where they are, and like things like telehealth. So that is one positive. Other barriers include just the individual. So if you have someone who's engaged in just the dosing component, but they're missing groups, they're missing their individual therapy sessions. Well, you're just, treating the physical symptom. You're not treating the underlying cause of why you were engaging in addiction. You're not treating your untreated trauma. You're not treating, the psychological distress that you may be encountering. And so with stress, we all know when we're stressed, we look for an outlet. That is a proponent of relapse, or a potential factor of relapse. So not working the full program is also a barrier, but that's on the individual level. So other barriers could include lack of transportation. If I have to come to a treatment facility daily or weekly, if I don't have transportation, that could be a barrier. If you have dosing hours that are from 5 a.m. and cut off at 10 a.m., I may not have gotten a ride there until 11. And then if I miss that dose, I'm, having withdrawal, and that's also a trigger for relapse. So that could be a barrier to treatment, things like transportation, financial components. Some individuals have trouble, paying for treatment. The good thing is with the opioid abatement money, there are some grants, and there is other ways that people can engage in treatment if they're having financial difficulty. So that's a positive, and that's helping to fill that gap in treatment.
Are there any other barriers that you think would be very important?
Homelessness.
Homelessness?
We have a lot of our homeless population who are opioid dependent. And so, depending on if they could get in a shelter the night before and get somewhat of a good night's sleep, or get bus tickets that the shelter might provide, they may not make it to treatment daily. So if they don't make it to treatment, they miss a dose, potential relapse.
Wow.
So homelessness, other social determinants of health not being met, food insecurity, and treatment deserts. A lot of individuals live in rural areas. For instance, here in Virginia, out in the western parts, Shenandoah, a lot of that is rural areas. And, the closest clinic to an individual may be 2 hours away, an hour away. I may not have the transportation, and if I have a car, I might not have gas every day to be able to drive, an hour and a half one way.
Yeah.
Yeah, and so that's a barrier to treatment. So just, as treatment specialists, us coming up with creative ideas like MAP buses and sending them out to the rural areas will help to mitigate that barrier of treatment deserts.
Wow. Well, I'm glad we're able to touch base on that because, as you mentioned, this is a lifestyle change, and recovery is an ongoing process. And just being aware, as you said, of what treatment, recovery, and staying away from relapse, what it entails, I think for the families and for the individuals, they need to be as prepared as possible, even though it's like how you've mentioned, it's different for everybody. So I appreciate you taking us through that in-depth discussion.
Absolutely. It was my pleasure, Bradley. And I do want to say, for just going back to when you asked how someone can start, there's a SAMHSA help hotline, and that number is 1-800-662-HELP.
Okay.
Simply calling that number, there's going to be a rep that will help walk through every phase of getting started with the treatment process, from assessing what they're currently using to what their treatment options are, and getting them to a facility in their area, based on their socioeconomic status, because someone may have barriers, again, financially, so they can look at, like, okay, hey, you may be in a you know low income area, you may be unemployed. I'm going to get you to the CSB over in, let's just say, Norfolk. They have a pool of money where they can, help you to, attend treatment for sometimes free, just depending on your situation. And again, just that 988 number, it's easier to remember. They can assist as well.
Are there any other resources that you would recommend for any individuals out there or families that, if they're not located here in the Hampton Roads area in Virginia, in the state of Virginia, or, nationwide? Is there anything that comes to mind?
Nationwide, you want to call that 988 number or 1-800-662-HELP.
Okay.
Um,
And that's the best starting.
the best starting point.
Oh.
Your local hospitals, they have a plethora of resources for opioid use disorder. They have social workers who can walk you through that process, get you assessed, and linked to treatment.
Okay.
Um, community services boards. If you have a community services board in your area, reach out to the community services board. A lot of community services boards also have a MAT treatment program. Not all, but a lot of them do.
Okay. I appreciate that. Thank you so much with that resource list. From your perspective, what gives you hope for the future of opioid addiction and the treatment? Would want to really get your thoughts on that.
I am so inspired, Bradley, by platforms such as this that are taking the time to understand opioid use disorder, effective treatment, ineffective treatment, what it looks like, and bringing awareness to this national epidemic. I'm also very hopeful for the future because provider bias has really been addressed more in continuing education courses for treatment providers, social workers, physicians. Believe it or not, a lot of treatment providers, substance abuse counselors, physicians, even nurses who work in the addiction field are against medicated assisted treatment. And those biases, it comes through in their work. They
Yeah.
think that they have a good control of it, a lot of times, but it comes through. And if our patients don't think that we are authentic and believe in the treatment and the possibility of them regaining their life and reestablishing, a life of sobriety and abstinence from illicit drug use where they're able to thrive, if they don't feel that we believe it, why would they? So I am so inspired by the shift. There's a paradigm shift, and even in our addictions literature, social work literature, nursing literature, physician literature about addressing your personal and professional bias. And so that's going to help to reduce the stigma around medicated assisted treatment, the stigma around substance use disorder as a whole. So I am just so inspired that we're moving in that direction. We've also experienced, at least in the last 20 years, a paradigm shift from where we looked at addiction as a moral failing, and now we're accepting it as a chronic relapsing brain disease, and we're treating it like we would treat hypertension or diabetes. It takes ongoing treatment. You may have some lapses, but you can recover from them, and you continue to go. You continue to educate yourself. You continue to implement new strategies to help be the best possible self that you can be. I'm also inspired that we are taking on new approaches with technology in things like WebMD and telehealth, where we're able to reach individuals in rural areas, and we're able to expand our options in treatment. We're able to help our patients maintain treatment compliance because we're giving them options. They can take their therapy sessions from their cell phone on their lunch break. That is wonderful. They can meet with their sponsor, through a social media platform. They can connect with people through social media. They can connect with people through, groups on Reddit and Facebook. So they even have apps like Smart Recovery that will help them to develop skills or enhance their skills. So I am excited about where we are going as a whole in terms of treatment. The awareness that is being brought to substance use disorder as a whole, but particularly for the sake of this segment, opioid use disorder, it's helping individuals to change their perspective. People are realizing like, wow, so not everyone, just started out, on this journey of addiction because they were just seeking a high or because they were just, just not a great person. Some people were, engaged in use to numb the pain from trauma, from pain. Some people had accidents and were prescribed medication and they got addicted to it. So it's opening up people's perceptions of this chronic brain disease. It's a disease. And with that, it's helping individuals to develop compassion. And so we're moving towards a place where we're more supportive of individuals who are experiencing addiction. And I'm excited about that.
I can tell because your tone and everything about it, like you're giving us like what to look forward to as we're addressing this disease. And I really appreciate you educating and breaking it down for us. Thank you for really taking us through the process and getting a better understanding of this. And I really appreciate you taking the time to really educate all of us on this.
Thank you for having me.
That wraps up this important conversation on life after opioid addiction. We hope this episode has shed light on the challenges of recovery, the role of medication-assisted treatment, and the support systems that make long-term healing a reality. If you or someone you know is struggling with opioid addiction, remember, help is available and recovery is possible. We encourage you to reach out to a healthcare provider or local support resource to get the guidance you need. We will link some important resources for you in the description of this video. We encourage you to reach out to a healthcare provider or local support resource to get the guidance you need. If this conversation was helpful, be sure to like this video, subscribe to our channel, and hit the notifications bell so you will never miss an episode. And if you know someone who could benefit from this information, share it with them. Stay connected with us on Instagram and Facebook at Sentara Health Plans, and visit sentarahealthplans.com to learn more about health plans and wellness resources. Until next time, take care and stay well.